Good evening, everyone. Welcome to our first episode for my first Instagram show, Speak to the Specialist. I'm very pleased today for having Dr. Ravalia all the way from London via Zoom with us today to talk us through a very important topic in dentistry and in medicine in general. He's going to be talking with us about sedation. So Dr. Ravalia is a dentist by profession, and he's a specialist in hypnotherapy and sedation. Dr. Ravalia, welcome.
Well, thank you for having me. It's great to be able to speak to my colleagues from around the globe. So thank you for having me.
We're very happy for having you. And I think this is a very interesting topic for me in particular, because I haven't come across sedation in my undergrad, and I haven't touched a lot on it throughout my master's. So I think that would be very beneficial for me and for everyone watching. So to start off, Dr. Ravalia, can you explain in simple terms, what does sedation mean?
Yeah, so the actual sort of clinical definition is conscious sedation. And the reason we use that term is because many patients think that they're going to be having a general anesthetic. And we know there's sort of a spectrum with something like conscious sedation, from the minimal sedation using a single drug to more maybe moderate sedation using multi-drug. And then obviously general anesthesia is where the patient is fully asleep and the anesthetist and anesthesiologist is keeping that patient alive because they can't breathe and they have no reflexes. But in conscious sedation, the reason why it's very safe for a dentist to use, for example, like yourself and me, in a general practice setting, is because they still have their reflexes. They're still breathing, they can still swallow. And obviously this is very safe when someone is having a dental procedure, because we use a lot of water with our drills, as an example. So we want that patient to be able to swallow comfortably and not have any problems with their respiratory system and the airway. So by definition, it's the use of a drug to allow a patient to undergo dental treatment in a very safe and manner, and defining it as the patient is conscious, but much more relaxed and unaware of maybe their surroundings.
That's great, because most of the patients who go to the dental clinics come with fear, they come with anxiety, and they even tell the dentist in the face, "We hate you. We hate dentists." So I think that would be an amazing modality to lessen the amount of "I hate you" in the clinic. So can you talk us through the safe uses of sedation and what are the indications of it?
Yeah, so I totally agree with you. I think any dentist anywhere in the world, regardless of your country of you're working, we face this problem. So something like conscious sedation is a very powerful tool to have in your skill set to help those patients. But obviously we need to look at what are the indications for using it. So we generally divide it into sort of three categories. So patients who are anxious, again, anxiety has levels, and you also need to look at the reason why maybe somebody may be anxious of the dentist. Maybe they've had a past traumatic incident as a child. Many people we see in their later ages say, they had some traumatic dentistry done as a child, and this has made them very anxious of the dentist. But again, we can look in other terms, someone may be phobic. So for example, a phobia is defined as someone's reaction to a normal stimulus that the average population wouldn't react to. So for example, let's take a cat, for example. So there may be many people in the world that are not scared of cats, but someone who's phobic of a cat, just even the thought of thinking of a cat in their mind might trigger them to have a panic attack, or they can't be in the same room as a cat. So for example, dental phobia, again, looking at what the reason for the phobia is. Are they scared of needles? Are they scared of the sound of the drill? There's many reasons why. Some people are claustrophobic. They don't like everything, the stimulus in the head and brain region. We have all the senses, the taste, the smell, the hearing, the vision. So all these senses that are there, and a lot of patients find that very obtrusive. It's a very sort of defined as your personal space, and someone putting all these instruments and using high-speed drills and things can really trigger someone's anxiety further. But we also can use it very comfortably and safely for patients who have medical conditions. So for example, someone who's got unstable or uncontrolled epilepsy, one of the sedative medications we use actually controls epilepsy in an emergency case, so we can give them these sedatives safely so they can undergo their dental treatment without the fear of having an epileptic fit. Other indications, for example, if someone has maybe some cardiac problems and we don't want to raise their blood pressure too high, which may cause, again, anxiety, increase in blood pressure, then we can use sedatives, again, very safely to be able to allow these patients to have their dental treatment done comfortably at their dentist.
I see. So we know that any dental procedure, no matter how simple it is, it might encounter some complications. It might imposes some risks. So, and I think that might be also the case with sedation. So what are the contraindications of sedation in dentistry that dentists should keep in mind in order to keep their procedures as safe as possible?
100%. So any procedure, any medical procedure, dental procedure, just if, for example, giving someone a local anesthetic without sedation carries the risk of someone having an anaphylactic reaction, as an example. So you as a dentist, every year you have your training how to manage medical emergencies. So in the same way, anyone who's working under sedation or in obviously hospital general anesthesia, as a dentist, you need to be trained in more intermediate life support to be able to manage any complications that can occur. But to prevent these or the risk of these complications occurring, we follow the American Society of Anesthesiology, which is a worldwide scale used by all physicians, all doctors, all anesthetists globally. And it categorizes the patients into sort of 5 categories, but we look at the first 3 categories in dentistry. So anyone who is ASA1, so that's American Society of Anesthesiology classification 1, means that person is completely fit and well. They have no medications, they've had no operations before, and they would be an ideal candidate to have something like conscious sedation at the dentist. The other scale would be ASA2, where the patient has a mild comorbidity, for example, maybe diabetes, asthma, blood pressure. And this definition allows for them to be able to take their medication. So their comorbidity is controlled by the medication. And these 2 categories will be very safe to be able to be treated in general practice. When you're moving on to something like ASA3, these are cases that we maintain for hospital, because this would be patients who've got sort of multiple complex medical problems and maybe not controlled well with medications. So they need to be treated in a secondary care setting where we have, again, advanced our colleagues as well to be able to assist if there was anything to go wrong. But I'd say if we stick with ASA 1 and 2, then this technique is used globally, literally every day. My practicing life is using sedation every day in my practice. So we use it very safely. And very interestingly, they found that dentists using conscious sedation were much safer than doctors. The reason being is because we're not trained in our undergraduate years. We don't train in airway management. We're not used to intubating patients. So we're very safe when we follow the regime. And they actually found that most of the complications didn't come from dentists using it. It was from doctors, because they felt, well, they kind of knew it all, and they were using a lot of different medications and drugs and putting them into a very deep level of sedation, which can verge on the edge of being unsafe. So complications arose with doctors and not dentists. That's probably something maybe different. A lot of your colleagues who don't work in this field may find quite strange, because you generally think, oh, well, the doctor would be safer, but it's actually the opposite way around.
Definitely. I think this is very interesting because growing up, I've always seen my dad using sedation because he's a gastroenterologist, whether he was doing gastroscopy or endoscopy or whatever. And it never crossed my mind that I, as a dentist, could be able to use sedation in a dental clinic, not in a hospital setting, and I can do that safely. So I think that was very interesting to know. And thank you so much for being with us today, Dr. Ravalia. I think that was very, very beneficial. And we look forward to having you again and again and again to talk about so many interesting topics, such as the beekeeper and hypnotherapy and other stuffs I will not talk about now. I will not spoil. So yeah, thank you so much. And thank you so much for watching. I hope that was helpful and beneficial, and have a lovely day.
Thank you then. Bye-bye for now.